If you have an upcoming consultation to discuss a revision to your breast reconstruction, it's really important that you spend some time before that consultation thinking about what you want to address. For my own revision patients, or for patients who've had their initial reconstruction elsewhere and are now seeking to establish care with me, those revision conversations can be pretty challenging. I've had patients come in who were dissatisfied with their reconstruction that they had done elsewhere, and they come in and some of the statements they say are, "I hate my reconstruction," or "My reconstruction isn't pretty," or "I just wish I had more projection, symmetry, volume." And those kinds of words can be challenging because what you think of as projection or volume or symmetry might be different than what I think of projection or volume or symmetry. So when I have my consultation or I have my own patients coming in to discuss a revision, first I ask them to describe what they would like to have better or more improved with their reconstruction. And it's so interesting because sometimes they will point out things and use words that I wouldn't have used to describe that. And that's why it's so important that you point those things out to your surgeon so they really get what you understand. So first, I have the patient talk about what they would like to improve, and then I say, here's what I see, and I point out different things on their breast, whether it's asymmetries or differences in sizes or whatever needs to be fixed. And then we figure out between what they brought up and what I brought up, what that patient would actually like to address, what's important to them. And then the second thing is it feasible to do what that patient is hoping for? Unfortunately, sometimes based on scar patterns or prior surgeries or reconstructive failures, it's not always able to be achieved what that patient is hoping to do. But having those conversations before surgery and really making sure that your vision aligns with your plastic surgeons is so critical to avoiding disappointments after surgery. If you had a revision surgery, how did you have that conversation with your plastic surgeon? Did you feel like it was something that you mutually talked about and agreed on what you should do? Or did your surgeon just tell you what you should have done? Let me know below.